Yes. Hi, everybody. Welcome. I'm so happy to be here with you today and my friend and colleague, Dr. Gabriele Faerber. We're having everybody meet the authors of our textbook on lipedema that will be coming out this fall. It is Lipedema, Principles and Practice of Diagnosis and Treatment. And Dr. Faerber is one of our contributing authors. I'm so happy to be here with you today, Gabriele. Thank you for joining us.
So am I. I'm really happy that you are having me again, and that I managed to write that chapter in your book. It's quite a heavy title, isn't it? Lipedema, Principles and Practice of Diagnosis and Treatment. It's a long title.
I know. It is a medical textbook on lipedema, and so we're thrilled to have all of the many experts, clinicians, and researchers that contributed, you being one of them. I want to tell people a little bit about you because your work is absolutely incredible, all the things that you have done and are doing. So Dr. Faerber has a clinic in Hamburg. She is the director of, I'm getting the name of it, Center of Vascular Medicine. And it is, she treats vascular conditions as well as lymphatic conditions. And you have been doing that since 2001. Is that correct?
Yes, I think so.
Yeah.
I've been doing it for longer, but we moved into our premises in 2001.
So that particular center in Hamburg since 2001. And then in 2008, I believe, you got trained in nutritional medicine. Mm-hmm. And soon after that, you began implementing that with your patients, specifically a protein optimized ketogenic diet. And that is the topic of your chapter that you did for the book. But I wanted to tell everybody too that Dr. Faerber she's constantly on the road. She is presenting at conferences all around the world. And I'm pleased to report that in August, she is the keynote speaker for, I think it is Lipedema Australia, their conference in Canberra, Australia. So she is constantly going everywhere to talk about various topics that have to do with lymphatic disorders. You were also the lead for the new guidelines, the German guidelines for lipedema, and were successful in getting nutrition as a part of those guidelines. So you've been incredibly busy and you continue to be so. So thank you for taking the time to be here and also for being available to present at our conference that we'll be having in September. So I wanted to give you a chance to talk a little bit about what you have in that wonderful chapter that's going to be in the textbook.
Well, I think it's quite a long time since I wrote it, but I think I summarized what I've been finding out. Mm-hmm. And how I've been treating my patients with lipedema, because you see, at the start, I didn't have the slightest idea that you could treat lipedema or you could improve lipedema symptoms by nutritional interventions. Because in every article, paper, textbook about lipedema, you could read it's not possible to influence it, to improve it by either sports or nutrition. So when we started, we started using machines that we got to know about in the Netherlands, which we hoped would decrease the subcutaneous fatty tissue. So in order to sort of find an alternative, possibly an alternative option to liposuction. And it fairly quickly turned out that it wasn't those machines, it was the nutrition. Because in order theoretically for the ultrasound lipolysis, which actually didn't really work, we gave it up since. But theoretically, in theory, for that to work, you had to cut down on carbs, because as you know, you have this treatment, ultrasound lipolysis. You go and eat a roll, and in comes insulin, and first your blood sugar spikes, and then in comes insulin and causes the fatty acids that we have dissolved more or less, the triglycerides, to go back into their places. So that was the reason why we started on a very low carb ketogenic diet. And when I realized that, because we had patients, after a while, we had patients who did the whole program, and others, because the machines are always more expensive, and others just followed the diet. And miraculously, the results were exactly the same. Did not achieve more weight loss, more volume loss, and certainly not more symptom improvement with the machines. And that's when I started talking about the diet and going into a deep dive about. At the start, I didn't have an idea what ketogenic diet was in the first place. So, you know me, when I work on something, or then I want to know the background, and I do a deep dive. And so it came that in 2010, I started presenting on this way of treatment. And funnily, it was the German world of phlebology and lymphology who were the first to learn about. And then 5 years later, I think there was this group in America who started using the ketogenic diet. And I remember right at the beginning writing on one of your, I don't know, chats or whatever it was. And it might have been LinkedIn. And I wrote, you need to give your patients more protein.
Right.
And I think it was Catherine said, "Oh no, that's not possible because protein spikes insulin, sugar,
yes,
sugar,
yes,
and so on."
Right.
So we got in touch. That's how we started, and then.
And you had already had quite a bit of experience in the diet at that point, and we were pretty new to it, and we're using the model that actually was used to treat epilepsy and to prevent seizures, which is a different nutritional guideline that you would use for that condition than you would use for lipedema. And so since then, understanding how important protein is, that is something that you brought to us, that we need to encourage people to have plenty of protein and to optimize it in their diet. Yes.
But of course, it's necessary to get the right measure. If you eat too much protein, then you get the blood sugar and insulin spike. But it's important to estimate each person's protein demands, which we calculate by 1.2 to 1.5 grams per kilogram not of the actual weight, but sort of not ideal weight, but normal weight. I estimate a patient 70 kilos would be a good weight for her, then I would tell her 84 grams of protein. And then according to her habits, her eating habits, we've got more and more vegetarians. So we have to try and find out how we can provide all the protein. Just sometimes it's not easy, especially for very tall women. It's not easy. And in that case, I might fall back on protein substitutes, but usually I try whole food.
Yes, yes, yes. And
And
I got to think that is probably just a healthy recommendation for everybody to make sure that you're getting as much protein as is appropriate for you. I think that going to a plant-based diet has probably been harming a lot of people, and making sure that they're getting at least some animal sources of complete proteins without having to always resort to a protein supplement. It's got to be healthy for most people. But particularly for someone who has probably been restricting their intake for most of their life, when they have lipedema, they've been trying to take care of their condition by starving themselves. And usually protein and fat is what drops off, and you're just eating mostly carbs. And so, which is opposite of helping them. And so I really see that what your program you've done in Germany is helped a lot of people, and particularly your patients with lipedema. I think it's been transformative, and your results have showed that.
And you are completely right. Most women with lipedema try to eat as little fat as possible, because they have been told for their whole lives that fat is the enemy. Whereas really, we both know that it's sugar, refined carbs, that are the enemy. Mm-hmm. So that, of course, it's not only the proteins, it's the reduction of carbs that mm-hmm. is important. And mm-hmm. I find it very interesting and very rewarding that in the last 4 or 5 years, there have been several papers, really good quality papers, mm-hmm. and recently from Norway for RCTs, randomized controlled trials,
yes.
which is not easy. I mean, this is my problem. I cannot easily do something like that, because
right.
my patients come to me because they want to be helped.
Yes.
So I can't say, well, I know you want to be helped, but you are going to do this diet and you are going to do that
yes.
diet. And
yes.
Yeah, I could promise them, and we switch after, I don't know.
Yes.
But, no, it's really difficult. We are hoping, actually, this is something, I'm not sure it will work out, but we are hoping to do something, a study comparing the ketogenic diet with GLP-1 receptor agonist.
Oh, interesting.
That is, it annoys me, to be honest. It's everywhere, and I just know. I mean, I have been treating these patients for so long now. I know that it's not really necessary,
right,
to use these medications.
Right.
And most of the patients who come to me are very open to give it a try. And so I tell them, look, we can start the diet, and if you are not successful, if you don't feel well, if you're still hungry and can't control your eating habits, then we might try the medications. And I have personally put one patient on the medication. I have 2 more. Well, actually, I have another one. Both of them lipedema patients, and I have a third one who was given it before she came to me, and we are now stopping the medication, Wegovy, and with the other 2, it has not really been successful, mm-hmm. and that confirms my conviction that it's, as long as the patients are willing and prepared to start this diet and to change their eating habits, mm-hmm. It's not really necessary.
Yes, and yeah.
It's actually, I think it's dangerous, because there was a lot of praise and jubilation. We have now conquered obesity and we don't need to operate on patients anymore. But slowly the cons are coming out. Like we were talking about proteins, how important they are for keeping your muscle mass.
Right.
And the biggest disadvantage of the GLP-1 receptor agonists is that obviously patients lose a lot of muscle mass. They more than with most other treatments.
Yes.
And do you know what I think? I think in those patients who are responders, where it works, they feel very often, at least for the first few weeks or maybe months, there is a sort of they don't feel well. They are nauseous. They have problems in their tummy. Their obstipation sets in, and so on. So they don't feel like eating.
Right.
That might be an effect that is wanted. But if you don't feel well, you eat wrongly. They don't eat. They don't either. They eat too little.
Mm-hmm.
They don't eat what they need to eat. They don't eat protein and vegetables. They might eat sort of, like spaghetti or pasta also, because that is something you can always eat if you don't feel well. Anyway, I have no other explanation. I think the problem is that most of the patients are giving those medications, but they are not given proper nutritional treatment to go along with it.
Right. Yes.
And since I've had this really good experience with the ketogenic diet, I just don't see the point really.
Yeah.
In lipedema, it might be different in other conditions, but in lipedema, I don't think it's really necessary.
Yeah, and I think that it's unfortunate that we're looking just at the number on the scale, and then okay, that number's going down, but you're not healthier. Matter of fact, you're probably less healthy because of all the GI issues and losing muscle mass and just lower quality of life because you just don't feel well. So it's unfortunate that the ultimate goal seems to be only that the scale is going down.
And compare that with the effects on the well-being we achieve by the ketogenic diet.
Yes.
Many patients tell me that they've never felt as fit in their lives, or at least in the last so many years.
Yes.
They sleep well. They are mentally and physically fit during daytime. They are not hungry. They have no cravings. They are active.
Mm-hmm. They're maintaining their muscle mass. They're losing fat mass, and their pain is significantly decreased. Yeah. All of these symptoms are significantly improved. So yes, it is probably is more work to have to change your diet. That could be more challenging than just having a pill or an injection, but the outcomes are just so much more better. So I would hope that more people would listen to you, but it is very tempting when you've been struggling for something with your whole life, that, the opportunity to take a medication seems very appealing. Yes. Yeah.
I know. And if you don't see the right person, then you go and see your doctor, and he might be just as frustrated with his efforts, and now he's got the injections, and okay, we'll try that. But the problem is, I think more than 50% of the people who use it, who start using it, stop using it, or them within the first year.
Yes.
So what happens? You have lost muscle mass. You stop the medication. You go back, and you go back to your old eating habits, and you put on weight even faster because you have less energy expenditure, and that's really a problem, and that's what we have been trying to avoid with ketogenic diet right from the beginning. We've always monitored the muscle mass.
Yes, yeah. And this is brings us to the importance of your chapter that you submitted for our textbook, really describing that protein optimized ketogenic diet and how it can be implemented, and encouraging clinicians to use this with their patients with lipedema. It's a huge contribution to our textbook. Be sure and look at the links below. There is a link for you to pre-order the textbook, which will be out in this fall. And so you can pre-order that on Amazon. But as well, Dr. Faerber will be presenting at our event, our virtual event that's happening in September 26, 27, 28. Right now, during the month of June, Lipedema Awareness Month, that is at a special price of only $57 for that 3-day event. And many of our authors who have contributed to the textbook will be there, including Dr. Faerber will be presenting as well. So we look forward to having you all there. Look for that link below. Dr. Faerber, thank you so much for, doing everything you do, but especially thank you for being here with me and talking about this very important topic to everybody.
Thank you very much for having me, and hopefully see you in person sometime very soon.
Sometime, I know. We are looking forward to that. Thank you so much. And we'll see everybody next time for another Meet the Author opportunity. Thanks, everybody. Bye-bye.
Thank you. Bye.